Okay, so with the phases of cardiac cycle or the cardiac cycle mind map, um, basically we have to first define what the cardiac cycle is. So it's a sequence of mechanical and electrical events that occur during one complete heartbeat, ensuring efficient blood ejection and filling of the heart chambers. So its importance is a proper coordination of the cardiac cycle. It is very essential in maintaining adequate cardiac cycle output and tissue perfusion. So the cycle is influenced by intrinsic myocardial properties, autonomic regulation, and hemodynamic load. And there are several phases of the cardiac cycle. Cycle is divided into systole, which is contraction, and diastole, relaxation, with each phase playing a critical role in effective pumping. So the diastole or the relaxation phase, there's ventricular filling and there's atrial systole. So the ventricular filling in the diastole or the diastolic phase, there's early diastole, there's under ventricular filling where there's rapid filling. And as the ventricles relax, the intraventricular pressure falls below that of the atria, leading to passive filling of the ventricles. The atrioventricular valves open, allowing blood flow from the atria into the ventricles. From the diastasis, which is a period of slower filling occurs as the pressure gradients between the atria and the ventricles nearly equalize. So most blood flow during diastasis is determined by the compliance of the ventricles. Okay, so the next is atrial systole, that is still under the diastole or relaxation phase. So the atrial cake or the atrial systole occurs near the end of the diastole when the atria contract, contributing to um, contributes an additional 10 to 30% of the ventricular filling. Particularly important when the heart rate is high or in conditions where ventricular compliance is reduced. So the systole or contraction phase, you have to remember the isovolumetric contraction, ventricular ejection, and finally isovolumetric relaxation. Right, so under systole or contraction phase, the isovolumetric contraction is defined as the initial phase of systole where the ventricles contract with no change in the volume because all the valves are closed. So the key events is that there's a rapid rise in intraventricular pressure until it exceeds the pressure in the aorta, the left ventricle or pulmonary artery, right ventricle. Then ventricular ejection at the onset when the ventricular pressure exceeds the arterial pressure, the semilunar valves and the aortic and pulmonary open up. And with the dynamics, the blood is forcefully ejected from the ventricles into systemic and pulmonary circulations, and the ejection phase is characterized by a peak in pressure followed by a gradual decline as contraction wanes. At isovolumetric relaxation or the phase um, is the phase following ejection where the ventricles begin to relax. The key characteristics are ventricular pressure rapidly falls while the volume remains constant because all the valves are again closed. And once the ventricular pressure drops below the atrial pressure, the AV valve opens up, initiating the next cycle. Alright, some hemodynamic concepts and pressure volume relationships. Remember the pressure volume loop. The pressure volume loop is a graphical representation of the changes in the ventricular pressure and also volume during one cardiac cycle. The key parameters are the end diastolic volume, the end systolic volume, the stroke volume, and the cardiac output. So the end diastolic volume is the volume of blood in the ventricle at the end of diastole, representing preload, and the end systolic volume is the residual volume of blood after ventricular contraction. The stroke volume is the difference between the end diastolic volume and the end systolic volume, and is the volume of blood ejected per beat. The cardiac output is calculated as the stroke volume multiplied by the heart rate, indicating the overall blood flow. When it comes to the loop phases, the ascending limb is the isovolumetric contraction. There's a rapid increase in pressure at constant volume. In the ejection phase, the pressure peaks and then declines as blood is ejected, with the corresponding reduction in ventricular volume. But the descending limb that is isovolumetric relaxation, the pressure falls at a constant lower volume. And the filling phase, ventricular volume increases at low pressures as the ventricles fill. The Frank-Starling mechanism concept is that the Frank-Starling law states that increased ventricular filling or stretch leads to a stronger contraction up to an optimal point. The physiological significance of this is that it enhances the heart's ability to automatically adjust its output in response to changes in venous return. The electrical correlation or correlates of the cardiac cycle. Remember synchronization, where the electrical event as recorded by the ECG provides a temporal framework for the mechanical event. So the P wave reflects the atrial depolarization preceding atrial contraction or atrial systole. QRS complex represents ventricular depolarization initiating the systolic contraction, and T wave corresponds with ventricular repolarization that leads into diastole. Explain the precise timing between electrical activation and mechanical contraction, which is excitation contraction complaint, ensures effective efficient pumping. The clinical correlations and implications: heart failure, there's alterations in the diastolic filling or systolic ejection, which can lead to increased stroke volume and cardiac output. So, like I said, with heart failure, alterations in diastolic filling or systolic ejection can lead to reduced stroke volume and cardiac output. With valve disorders, abnormal valve function disrupts the normal flow pattern of the cardiac cycle, affecting efficiency. With arrhythmias, disruptions in the normal sequence of electrical events can lead to uncoordinated contractions and impaired filling or ejection. So, in summary, the cardiac cycle encompasses the entire sequence of events from ventricular filling, which is diastole, to contraction, which is systole, and relaxation. And the pressure volume loop provides a powerful visual to understand the dynamic changes in ventricular pressure and volume. Proper coordination of electrical and mechanical events is essential for optimal cardiac performance, and understanding these principles is key in diagnosing and managing various cardiovascular disorders.